Welcome back to the Health, Wellness and Wellbeing Hour on Chalk Hill Community Radio, the station that keeps you connected. And this is the show designed to improve health literacy, address health inequalities, and to promote quality health. And today we're going to be improving health literacy and promoting quality health by talking about stroke awareness, recovery and survivor voice and community support. And to help us break this conversation down, very shortly, I'll be introducing my special guest today, Arnold Matimba. But before I introduce Arnold, let me just start by saying that every year, around 100,000 people across England, Scotland, and Wales experience a stroke. And that's approximately one every 5 minutes. And behind each number, there's a person whose speech, movement, memories, independence, relationships may be changed without warning. And the urgency is particularly significant for Black communities. UK evidence shows that people from Black African, Black Caribbean backgrounds face a higher risk of stroke and of developing high blood pressure, which is one of the most important risk factors. A recent NHS analysis of stroke patients in London found that Black patients experience stroke at an average age of 65, compared with an approximately 75 among white patients. It also found higher recorded levels of hypertension and diabetes among the Black patients studied. And these figures are not shared to create fear or suggest that stroke is inevitable, but they remind us why awareness, blood pressure checks, early action, and equitable access to support matter. A stroke can happen at any age, and recognizing even one possible sign, facial weakness, arm weakness, or speech difficulty, means calling the emergency services immediately. But this conversation, it also needs to extend beyond the emergency. We need to know and understand what happens after hospital discharge. How do survivors rebuild their confidence and independence? Who supports the carers and families? And are the people living with the consequences of stroke, are they genuinely influencing the services designed for them? And to help me explore these questions, I'm delighted to welcome Arnold Matimba, very passionate community champion, who is the engagement lead for the Stroke Association's Southeast Locality. Arnold works closely with stroke survivors, carers, NHS professionals, and voluntary sector organizations to strengthen stroke pathways, champion survivor voice, and improve support beyond the hospital setting. He brings extensive experience in partnership, working and systems leadership. And as a fellow radio presenter, he also understands the power of conversation to inform, connect, and inspire action. Good afternoon, Arnold, and thank you so much for taking time out to come on the Health, Wellness, and Wellbeing Hour.
Thank you for having me, and that was a very humbling introduction. Thank you so much.
Thank you so much. Thank you so much for all the great work that you're doing in the community. It's very, very important and timely, as we'll be discussing further on. So Arnold, so tell me, what do you enjoy actually most about being behind the microphone and as a radio presenter? And does it influence the way that you engage people in the work that you do?
Absolutely. I think one thing that I enjoy the most is really just connecting with the people and getting that feedback that people are enjoying what you're doing, and sometimes they can kind of identify whether it's a song that you play, whether it's a one nugget message you say on the airwaves.
Yeah.
So that's quite rewarding when you know that you are adding some sort of value to people's lives.
Absolutely, absolutely. And by the way, folks, Arnold plays some really, really great music. Yeah, you need to check him out on Sanctuary Radio, and I'll please plug that with us later on. But anyway, Arnold, so let me start off by asking, tell tell us about your journey, basically, into the Stroke Association and what drew you to stroke support and community engagements.
Yeah, absolutely. So I joined Stroke Association because of my passion for creating positive social impact
Mhm.
through partnership, engagement, and service improvement. I come from a corporate background. I worked in telecoms, aerospace, and defense. So I've
Mm.
got a very strong project management background and a relationship building background. So I just felt that I needed to use the skills that I gained in my previous employment to make sure that I'm actually adding value where it really matters. So what attracted me most was the opportunity to support stroke survivors and their families as they navigate through life after stroke.
Yeah.
Throughout my role, I've worked closely with communities, health partners, volunteers, and people with lived experience to ensure support is accessible and shaped by their needs. I strongly believe that effective community engagement is about building trust, listening deeply, and empowering people to influence change. And what
Yeah.
continues to inspire me is seeing how collective action can help rebuild lives and ensure that no one faces stroke alone.
Yeah, 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 absolutely, absolutely good. And was there a particular experience or maybe a particular person who made the importance of this work especially real for you?
Well, my dad did have suffer a stroke. That's
Mm.
many years ago,
Yeah, yeah.
and but obviously, we knew he had a stroke, but we didn't really quite understand what had happened or what caused it.
Mm.
So, but fortunately, he had what is called a transient ischemic stroke.
Hmm.
So it's a TIA, transient ischemic attack. So sometimes it's referred to as a mini stroke.
Okay.
So he didn't have extensive damage to him. So his recovery was pretty much, quite quickly. But we didn't understand any
Yeah.
of those things. It's things that I've actually picked up as I joined the Stroke Association and really got to understand what stroke is and
Okay.
how it actually affects people.
Good, good. And I think as we go along, I might ask some questions to further expand on that because I didn't actually know that there are different types of strokes, but
Yes.
yeah, but we'll probably touch on that. But I wanted us to start off by talking, please explain to us what is a stroke and what are the most important things that people need to understand about a stroke?
Yes. So, a stroke really it's a brain attack.
Mm.
And it's something that occurs in the brain. So normally what happens is there may be a blood clot that occurs somewhere along, in your body and it just travels up an artery to your brain. And it's then lodged there and starves the brain of oxygen.
Mm.
Um, and the minute that happens, brain cells start dying. So we're talking about millions of brain cells dying. So the longer it takes for somebody to get medical attention, the
Mm.
more damage is done.
Mm.
And so that's one type of stroke. And then the second type of stroke is a hemorrhagic stroke, which is a bleed that happens in or around the brain.
Mm.
And that can also cause really severe damage to an individual. And then the one that I've already mentioned, which is a transient ischemic attack, which is a mini stroke. So with the mini stroke, what happens is that I mentioned a blood clot that travels up the artery. So what happens, it once it gets lodged in the brain, it clears itself quickly. So there's no real damage that happens.
Mm.
But that one is critical to understand that when that happens, it's an indication that a stroke is going to happen at
Mm.
some point. So again, medical attention is important.
Yeah.
If anybody has suffered a mini stroke, that they receive medical attention.
Okay, good. And then prior to that, are there any key signs of stroke that people should never ignore?
Yes, absolutely. And I believe, people may have seen the fast advert on TV or,
Yeah.
signage on ambulances
Mhm.
around,
Mhm.
driving around. So really, this is part of stroke awareness. So when we talk about stroke awareness, the most important message is that stroke is a medical emergency, sorry, and can happen to anyone regardless of age or background.
Yeah.
So too many people still believe that stroke only affects older adults,
Mm.
but recognizing the signs early and acting immediately can save lives
Yeah.
and significantly improve recovery. So
Mm.
the key signs people should never ignore or, you know, uh, are captured in the FAST test. So what, FAST is an acronym for, face, arms,
Mm.
speech, and time.
Yeah.
So, things to look out for is, has one side of the face drooped? Can a person smile properly?
Mm.
And can they raise both arms and keep them above their head? Or is one arm weak or numb? And then when it comes to speech, is their speech slurred? Is it confused or difficult to understand? Any of these signs, if you notice any of these signs, it's time to call 999 immediately. And it's vital to act quickly because every minute counts during stroke. The faster someone receives specialist treatment, the greater their chances of survival and recovery, and the lower their risk of long-term disability.
Mm.
That's why raising awareness and encouraging people to act fast remains one of the most powerful ways I believe that that can help improve outcomes for stroke survivors.
Yeah, absolutely. And I'm assuming that one of the things that might prevent people from acting fast is if they're hesitant to dial 999, for example. Have you seen a reason why people might be hesitant in dialing emergency numbers?
I think it's down to not really knowing the symptoms of stroke. So, you might see somebody or come across somebody whose speech becomes slurred, and it's easily to, confuse that or mistake that person for
Mm.
drunkenness.
Yeah, yeah.
But if it's somebody that you know really well, rather than making assumptions, it's always really best to err on the side of caution, which is
Mm.
why we
Mm.
always encourage people that don't delay, just call 999. I think it's better for an ambulance to come and then they do their diagnosis and find that maybe it's not a stroke than to take that chance
Yeah.
and somebody then ends up with a severe disability because they didn't receive help as quickly as possible.
Yeah, 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 yeah. Okay. All right, good. Thanks for that. So let's talk about life after stroke. So 'cause many people understand that the main, or maybe many people think that the main issue is surviving a stroke. But life
Mm.
after stroke can bring a lot of challenges, kind of hidden challenges. So please explain, what do people often underestimate about the recovery?
Yeah, I think one of the biggest misconceptions is that recovery ends when somebody leaves hospital. But
Mm.
for many stroke survivors, that's when a new set of challenges
Yeah.
begins when they leave hospital.
Mm.
Because in a hospital setting, I mean, you feel secure, everything is being done for you, you are in a bed, there aren't any challenges that you would
Mm.
face when you go home. So it's only when people are actually at home that they start, experiencing the set of challenges. Stroke can affect far more than physical mobility.
Yeah.
Survivors may experience fatigue, communications difficulties, memory, and concentration problems. So, as well as change in mood, anxiety, depression,
Mm.
loss of confidence,
Yeah.
and independence.
Yeah.
So, these challenges are often invisible to others, which can make people feel isolated and misunderstood.
Yeah.
So recovery is rare, also rarely it's not it's not a straight line. Progress can take months, even years, and many survivors have to adapt to you know, a very different way of life, working and engaging with their families and communities.
Yeah.
That's why
Yeah.
it's support after stroke is so important.
Mm.
It's
Mhm.
not just about rehabilitation, it's about helping people rebuild their lives, regain confidence, reconnect with their communities, and achieve the best possible quality of life.
Yeah.
And I think that what most people also misunderstand is or underestimate is the resilience that's required, not
Mm.
only from the stroke survivors, but also from their families and carers. with the right support, we find that um, with the right support, information, and connections, people can make remarkable progress. But no one should have to navigate through that journey alone. And I think that's where we come in as an organization.
Yeah, yeah, absolutely, absolutely. And I'm just to quickly add to what you're saying there. I'm believing that the loss of independence is a big knock-on thing for a lot of people, isn't it? Yeah,
It is. I
yeah,
mean, you find that, someone will have limited movement, or
mm,
sorry, mobility. So, one day you could dress yourself, and then the
mm,
next day you wake up, you can't dress yourself, or you
mm,
can't even take
yeah,
yourself to the bathroom. Now you
yeah.
need somebody to help you do those things.
Yeah, absolutely, absolutely. So in that recovery, so obviously carers and family members, they have a big role to take in that. So because we know that stroke, it doesn't only affect the survivor, it affects the whole family, the carer, the families. So please explain, what kind of pressures do carers and family members often carry after a loved one has had a stroke?
Yeah, absolutely. I mean, as you've
Mm,
said, stroke
mm,
doesn't just affect the individual who's had the
yeah.
stroke. It can have a profound impact on the entire family. So overnight, partners, children, parents, friends can find themselves taking on new responsibilities and adapting to significant changes in their daily lives. So many carers experience emotional pressure as they support loved ones through recovery, while also coping with their own fears, uncertainty, and concerns about the future. And they're often, balancing medical appointments,
Mhm,
personal care, household
mhm,
responsibility, finance, employment, all the while to be, a source of strength for someone else.
yeah.
So there can also be a sense of loss. Relationships may change as family members adjust to new roles, and carers sometimes put their own health, well-being, and social connections to one side so that they can focus on the person they are supporting.
Mhm, mhm,
What is often overlooked is that carers also need support.
yeah.
They need access to information, practical guidance, emotional support, opportunities to connect with others who understand their experience.
Mm,
So that's why it's important that stroke support takes a whole family approach.
yeah.
And when we support carers and families alongside the stroke survivor, we help them create the stability
Mm,
and resilience and
mm,
confidence that enables everyone to move forward together.
yeah.
So it is important. Um, we have various support groups in all the areas that we have services that
Okay.
people can tap into so they can have peer-to-peer support. And that's really important when you hear the voice of lived experience. It
Yes.
encourages, people who recently had a stroke to hear from someone who's had a stroke maybe 2, 3 years ago, talk through what they've been through. And
Mm,
it's a source of strength for stroke survivors.
very good. Is there a way that people can find out, maybe anybody going through the recovery or their family, their carers, how they can tap into those support groups? Maybe
Absolutely. So
nearer to their areas or yeah.
yes, absolutely. So on the Stroke Association website, there's a section called support and guidance. So
Okay.
under that section, it's got an option for support in your area. So what
Okay.
people need to do is just put in their postcode, and then it will list the
Mm.
support groups that are close to where they are.
Okay, wonderful. Good. Thanks for that. And still talking on about the carers' family members, what would you say to someone who's caring for a loved one but feels guilty about having to acknowledge their own needs?
That's very common.
Mm,
We come across, like family members who do not actually want to be referred to as a carer because, for example, a wife, and we say there's support for carers, and they'll say, "I'm not his carer, I'm his
mm,
wife."
yeah.
So they don't want to wear that carer cap. They still
Yes.
want to consider themselves a wife, a daughter, a brother, a husband. So it is challenging for people,
Yeah.
I must say.
Yeah. Yeah.
But
Yeah.
one th thing I can emphasize on is that support is there, support is available.
Okay, good. Well, support is available. We just have to find it. And you've explained where we can on the Stroke Association website. All right, good.
Yes.
Good. So let's talk about survivor voice and better services. So you've talked about championing survivor voice. Why is it so important that stroke survivors are listened to when services and pathways are being shaped?
Yeah, that's a really good question, and it's something that I probably took for granted when I first joined. I didn't have the real understanding of
Mm,
why survivor voice is important.
mm,
Um, but what I've got to learn and what I've experienced myself is that survivor voice, the stroke survivors are the experts by experience. While healthcare professionals will bring the clinical expertise,
mhm.
survivors bring the invaluable insight into what
Yeah.
life is really like after a stroke,
Mm,
including the challenges, the gaps in support, barriers that may not always be visible within the healthcare system. So, when survivors' voices are genuinely heard, service becomes more person-centered, I believe, and more responsive and more effective.
mm,
They also help us understand what matters most. So whether it's access to rehabilitation, emotional well-being, communication support, or returning to work, or simply feeling connected to their community. The lived experience ensures that the services are designed around real needs and rather than assumptions. So I think that's why it's so critical that we do capture lived experience voice. And championing survivor voice is also about dignity and empowerment. People affected by stroke should have a meaning role in shaping the decision that impact their lives. So when organizations listen and act on on that feedback, we create better services and stronger partnerships, and ultimately better outcomes for stroke survivors and their families.
yeah, yeah, absolutely. And what would a very good stroke pathway look like when it truly supports people beyond hospital discharge?
Um, I would say that a good stroke pathway doesn't end at hospital discharge. It
Mm,
provides seamless, coordinated support throughout a person's recovery journey. And I believe that it starts with high quality acute care
mm,
and rehabilitation, but it then must also ensure that people receive the right support once they return home. That means clear information,
mhm.
ongoing rehabilitation where needed, emotional and psychological support, access to community services, as I mentioned, like peer
Yeah,
support groups, also practical help for families and carers. So the best pathway, I would say, are built on strong collaboration between the NHS, local authorities, voluntary sector, community groups, and people with lived experience.
okay. Sounds really good. And where are people most likely maybe to experience maybe gaps or fall in between services?
It's that normally tends to happen when people, are released from hospital. As I
Mm,
said, clinicians are there to provide, clinical support. And as soon as somebody leaves hospital,
yeah,
their responsibility ends there. But then what happens to that person when they're at home? Um, that's where the gaps start,
start to, yeah, yeah.
you start seeing gaps.
Mm,
So then, if there are no proper follow-ups, somebody can miss rehabilitation because there should be a 6 weeks rehabilitation window where
that's
people are given physiotherapy if that's required, whether it's
mm,
speech therapy. But people may fall through the net
yeah,
and
yeah.
don't get that support, which
Mm,
then affects their recovery.
very good. Yeah, yeah,
So th that's where the gaps are. And we try to fill in the gaps by working very closely with all NHS trusts to ensure that when people leave hospital, they send referrals to us. So then we do the follow-up,
yeah.
make sure that they they've got all the information that they require. They've got all the support they require. And it is really important that it helps people rebuild their lives and achieve their personal goals and ensure that they never feel alone on their recovery journey.
Yeah, that's really important. Very, very important. Okay, so let's look at the community. We'll look at partnerships and leadership and community awareness. So
Mm,
how can local communities, and so I'm referring to like maybe community radio, faith groups, barbershops,
mm.
saloons, community centers, trusted voices. How can all of these help in spreading their awareness more effectively?
Um, I would say, I mean, I'm now just speaking from experience, that one of the most effective ways to raise stroke awareness is to take the message beyond traditional healthcare settings
Mm,
and into the places where people live,
yeah.
work, worship, and connect. Um, Often you hear the phrase hard to reach
Mm,
communities,
mm,
and
mm, mm.
I challenge that very strongly. I don't believe that there's any community that's hard to reach. It's about how are we trying to engage with them. So communities are often influenced most by people and organizations that they already know and trust. So it's about organizations building trust with communities. So that what opens the door for them to kind of, start engaging with them. When it comes to local radio, faith leaders, barbers, or hairdressers,
Yeah.
and grassroots groups. I believe they have a unique ability to reach people who may not regularly engage with health
Mm,
campaigns or services.
mm, mm.
They can help share life-saving messages through, about recognizing the signs of stroke, understanding risk factors, and knowing when to seek urgent help. These trusted voices, I believe, can also help tackle misconceptions and encourage conversations that might not otherwise happen.
Yeah.
So whether it's a discussion after a faith service, a conversation in a barbershop, community health event, or local radio, as we're doing right now,
Yeah.
I believe that these settings create opportunities to reach people in a relatable and cultural relevant way.
Yeah.
For me, the key is partnership.
Mm,
When healthcare organizations work alongside local communities rather than simply communicating to them, they build trust and they increase understanding and ultimately help people recognize that stroke is both preventable and treatable when action is taken quickly.
yeah. Yeah. Absolutely. Absolutely. And let's talk about some of those. Let's talk about some of those things that we need to take more seriously in order to
Mm,
reduce the risk of stroke.
sure. Um, I think that the encouraging message is that many strokes are preventable.
Mm,
But prevention starts with understanding and managing the risk factors we can influence. So high blood pressure, for example, you've mentioned it in your intro, is one of the biggest risks factor for stroke. And unfortunately, most people or many people don't realize they have it because it's often not it doesn't have symptoms.
mm,
So that way, regular blood checks, I would say, and routine health reviews are very, very important. Particularly in our own community where we have the risk of hypertension. People should always take a proactive approach to overall health by having regular health checks and seeking medical advice when concerns arise. Managing conditions such as high blood pressure, diabetes, high cholesterol, atrial fibrillation, maintaining a healthy diet and a healthy weight, staying physically active. If you smoke, I would recommend that you stop smoking.
mm,
Limiting alcohol consumption if you drink, and taking your prescribed medication as advised by your healthcare professionals.
yeah.
But
Yeah.
perhaps the most important message is not to wait until there is a real problem. Prevention is often about small, consistent actions that reduce risk over time. So
Mm,
ultimately, in terms of stroke awareness and stroke prevention, I believe they go hand in hand.
mm,
By understanding the signs of stroke and acting fast when symptoms appear, and taking the necessary steps to manage our health, we can help save lives, reduce disability, ensure more people can live healthier lifestyles for a longer time.
yeah. Yeah. You touched on medication there. what I know you're not a clinician, but what would you say to people who would rather not be they would rather not be sentenced to a lifetime of medication to manage their blood pressure, you know?
Yeah.
Because I hear that a
Um,
lot, you know.
yeah, I know I do too.
Mhm.
I know that there are
Mm.
people who also have who believe from a religious perspective that,
Yeah.
they can pray and,
Mm.
pray
Mm.
away that
Mhm.
illness,
Yeah.
if I may call it that.
Yeah.
I would just say that, it's always advisable to seek healthcare, advice.
Mm.
If
Mm.
somebody feels that, they don't want to be taking medication for a prolonged period, then they need to speak to professionals and see if there are any alternatives rather than to just say, I'm not going to do it and just
Mm.
stop. I
Mm.
think it's always important to get that advice from professionals before we
Yeah.
make
Before.
drastic decisions.
Yeah.
Yeah.
Yeah. Yeah, absolutely, absolutely. So, and if someone's listening today, or if someone listening thinks that a person may be having a stroke, what should they do immediately? I mean, I know we've referred
Yeah.
to that already. Yeah. Anything else that you might want to add to that?
And I think if someone thinks someone may be having a stroke, the most important thing is not to wait and see if the symptoms improve.
Mm, mm, mm,
So
mm.
I think, yeah, I'm going to sound like a broken record. I think
Yeah,
call 999
yeah,
immediately.
yeah, yeah.
Stroke is an emergency, a medical emergency, and fast treatment can save lives and reduce the risk of long-term disability. So I'd encourage people to always remember the fast signs. Has
Mm.
the face drooped? Can the person raise their arms and keep them, you know,
Above.
up?
Yeah,
Is
yeah.
their speech, slurred? Are they finding it difficult to
Mm.
understand what they're saying? um, and call 999 straight away if they notice any of these signs. Even if the symptoms seem mild or, disappear after a short time, it's important to seek emergency help because if they disappear after a short while, it could have been a TIA, which I mentioned earlier.
Yeah, yeah.
So a mini stroke. So stroke symptoms can come and go, but urgent assessment is still essential. So my
Mm.
message to listeners would be to not to try and diagnose anything themselves. And one other thing I can also try and impress on people is don't drive anyone that you think is having a stroke to hospital.
Okay.
Call
Yeah,
999
yeah,
and
yeah.
act fast. It could make all the difference that someone, to someone's survival and recovery.
Okay, all right, good. And for those who maybe anybody listening who maybe they've recently had a stroke or they're caring for someone with a stroke, they should always go to the
Mm.
website for resources, for information to support them.
I would say a good starting point is to
Yeah.
speak with their healthcare team,
Okay.
GP, stroke nurse, or
Mm,
their rehabilitation professionals who can help signpost them to local services and
okay.
ongoing support.
Mm,
Stroke survivors and carers, I think, can also access information, practical information through our website, the Stroke Association website, which offers a range of services to help people adjust
mm,
to life after stroke. I'd
mm,
also encourage people to connect with local support groups, community networks. Meeting others who have shared similar experience can help reduce
mm,
the feeling of isolation and can also help build confidence and provide reassurance that recovery is possible even when the road ahead feels uncertain.
yeah,
So
yeah.
for carers, I would say that it's important to remember that their well-being matters too, and
Mm,
not to be afraid to ask for help
mhm,
or to seek for advice or access support for themselves.
yeah.
Caring for someone after a stroke can be rewarding, but
Mm,
it can also be challenging, and no one should be expected to carry that responsibility on their own.
mm,
So my message really is quite simple. Take that first step, ask
yeah,
for support,
yeah,
stay connected. Recovery after stroke is a journey.
yeah.
And with the right information, services, and community around you, you don't have to face it alone.
Absolutely. You don't have to face it alone. Wonderful. And finally, Arnold, so when listeners remember this conversation, what is the one message you would want them to take away about stroke awareness, recovery, and support?
I think after everything that I've said, I would like people to remember that stroke is a medical emergency.
Hmm.
And that the recovery is a lifelong journey and no one should face it alone. So knowing the signs of stroke and acting fast will definitely save lives and reduce the impact of stroke on someone's future. At the same time, we need to recognize that recovery doesn't end when a person leaves hospital. So many stroke survivors and their families, they face physical and emotional even financial challenges long after the initial event. So my message really is simple is, learn the signs, take prevention seriously, and support those affected by stroke. Make sure you're checking your blood pressure, attend health checks, seek medical advice where needed, and don't ignore any warning signs. And if anyone, or someone has been affected by stroke, please remember that there is help available. Recovery looks different for everyone, but with the right support, information, and community around you, people can rebuild their lives, regain independence, and continue to live a fulfilled life.
Mm.
But ultimately, stroke can happen to anyone.
Mm.
But together, through awareness, compassion, and action, we can help ensure that fewer lives are affected and that no survivor or carer should feel that they need to navigate this journey alone.
Absolutely, absolutely. And I think that's a very powerful message on which to end. Arnold, thank you so much for sharing your knowledge and for helping us understand that stroke awareness is not only about recognizing an emergency, it's also about supporting survivors and families throughout the journey that follows. So, Arnold, thank you so much for informative and an important conversation, and for the work that you continue to do alongside stroke survivors, carers, families, and partner organizations. Um, Today's discussion has reminded us that stroke awareness must lead to action. Remember fast, face weakness, arm weakness, speech problems, time to call 999 if you're here in the UK. Even one possible sign of stroke is an emergency. And so never wait to see whether it passes. We've also heard that the impact of stroke does not end when someone leaves hospital. Recovery can be long, it can be complex, but carers need support also. And the voices of survivors must remain central to improving services. If you or someone you care for has been affected by a stroke, visit stroke.org.uk or contact the Stroke Association Stroke Support Helpline. So thank you so much, Arnold, once again. It's been a real pleasure having you on the show today.
Thank you for having me and for the opportunity to share with your listeners.
It's a pleasure.
Thank you.